to make sure that we have a hospital or something that they can have once they get out of service. I was at a Peachtree organization and heard it from a couple of veterans who were talking about this psychological problem they're having after they come out of the war in Iraq, and they're basically not getting any care. They're wandering around. They don't have any housing. They don't have any skills, any jobs to go to. So this is something I think that the President has a good plan for getting them some skills so they can find a job. My brother is a doctor up in Idaho, and I was going to introduce you to some technology that they're using up there. He owns a little, he's in charge of a little rural hospital where they're using the latest technology called RoboDoc. And this is where they have specialists look at their patients on this little computer-looking screen where the doctor is able to see the patient, he's able to take all the vitals, and he's able to give a diagnosis to my brother, who is the doctor, who is treating the patient there. So we do need to think out of the box. We may not have the money, but we can treat our veterans and give them the best quality care. So yes, we do need to think outside of the box. We need to bring new technology. We need to help our veterans because they gave so much to us. Thank you.
I think it's a good idea when it comes, nobody wants to see our veterans suffer, especially after they have served their country, and not just them, but their families and their children. And I have met many veterans throughout the campaign and previously growing up. And I think that when we think outside the box, we can go even further than that. We have been fighting for a VA hospital for as long as I can remember. And we have the clinic now in Harlingen, and despite that, we still have many veterans who are not getting the care that they need in a timely manner. Many veterans who I do speak with, their primary complaint is that, one, they don't see the doctor in a timely manner, or two, they are not getting the diagnosis or the medications that they need when they need them. And so, if we are thinking that we are going to solve the bigger problem by putting a hospital in the valley, yet keep the delay in the process of their treatment, it will not benefit our veterans at all. What we need to do, and what I am for, is a system, a voucher system, where a veteran has the right to choose his doctor, has the right to, just as we would choose a private doctor, go set an appointment and be seen in a timely manner. I think that that would be something that would be more beneficial to them. They would feel that they're getting the attention that they need when they need it, and they'd be able to get their first, second, or third opinion from any doctor. There are many cases that have happened since dating back to the Gulf War, where now veterans are not getting the diagnosis that they feel, or the illness that they feel they have, because within the VA system, the federal government will not cover X, Y, or Z symptom. And so they get left outside, and they don't get the care that they need. So I think that thinking outside the box would be great. A voucher system that gives the veterans and their families more independence and choice is where I would rather go.
I'm a veteran. My father's a veteran. My uncles are veterans. And one of the things that we've had here in the Valley for a long, long time is, unfortunately, people telling us that we should have a VA hospital. It hasn't happened. It's something that isn't around the corner. And the reason for that, unfortunately, is voter turnout. Because we have 2 in 10 people vote, we don't have the power that we should have. Texas has 4 new congressional districts. We picked up 4 new congressional districts. The Valley has the opportunity to have its own voice. And we need to take that voice to Washington. And not just talk about getting a veterans hospital. Not just talk about thinking outside the box. But actually pushing for it. Because at the end of the day, we want our veterans, the people who have taken the time to step up for their country, to have face-to-face service with a doctor. To be able to go in and have a place that they can call their own. And that's what it's about. It's about the respect to give to the person coming home from Afghanistan and Iraq. It's about the respect to give to our fathers and our grandfathers to have their own facility. The voucher program is a wonderful program. It's a stopgap measure. But at the end of the day, Texas itself has the highest former military population in the country. The Valley has a huge percentage of that. We deserve that respect, and something that I, as a